Going beyond the headlines. Asking the questions you want answered. Exploring government policies and how they impact you. We are delving deeper.
Good evening and welcome to Delving Deeper. I'm your host, Kimberly D'Souza. Joining us this week is the Minister of Health, Minister Terrence Deyalsingh. Minister Deyalsingh, thank you so much for joining us.
Thank you for having me, Kimberly. Pleasure to be here.
Of course. Minister, by now you must have lost count of the number of interviews you've done over the past 2.5 years as it relates to the COVID-19 pandemic. I mean, your ministry would have kept us up to date daily on what was happening with the virus. As it stands now, where are we as it relates to the COVID-19 virus?
Where are we now? We are in a relatively good place now, Kimberly, as we come to the end of this acute phase of the virus. How do we judge that? We judge that by numbers. Numbers don't lie. So our hospital numbers are now averaging around 110, which is very good. Our rolling 7-day average now is around 120. You would recall, Kimberly, in the bad old days, we were clocking 700 cases a day and so on. So we are now down to around about 120. Our ICUs are less than 15% occupied. So based on those numbers, deaths have come down dramatically. Based on those numbers, we are seeing some light at the end of the tunnel as we come to the end of this acute phase of the virus, but the virus is still there. Right. We are still clocking over 100 cases per day.
Now, Minister, we are coming out of the pandemic, and what we've been seeing as we move into that July-August vacation is a number of fetes happening. And the numbers that we're recording is actually what was similar to pre-pandemic when we didn't have a coronavirus or COVID-19 to consider. If we keep this up, what is going to be the state of the country? Are we going to be seeing new virus or new cases soon?
Well, as I said, earlier I said, in the bad old days, we were clocking over 700 cases a day. We are down to 121 as a rolling 7-day average, which is reasonable. We have seen no uptick in recent days or weeks that could be attributed to any mass event. So what that probably means is that we have a population that is 51% vaccinated, about 180,000 persons boosted, and then to that you have to add another few 100,000 persons who have been immunized or through to infection. So we are in a reasonable place now to allow people to do things as normally as possible. Again, the numbers don't lie, but I am concerned about people taking risks that they should not be taken in the public domain. My advice is that we should wear masks based on your own personal risk assessment, especially if you are immunocompromised. If you're a young person, but then when you go home, you have people at home who are not vaccinated. You have the elderly that you could pass on the virus to. So we have been consistent over the past 8 or 9 months since we started vaccinating to ask the individual to take some personal responsibility now instead of relying on the state to take action on your behalf.
But Minister, I mean, is it enough? Because you've been saying it, the Prime Minister has been saying it. We want to let the citizens have the personal responsibility. Is that enough?
Yeah, I think at this stage of the pandemic, you want to have persons, and I say we have to color this, remembering that I always say risk and reward. If we shut down all these events, we increase unemployment, we decrease economic activity. Social events are a great economic driver. So we have to be aware not only of the health consequences, but also the economic consequences of keeping the economy closed. So we are very comfortable at this stage of the pandemic, given the numbers that I have spoken about, that asking persons to accept their share of personal responsibility is the way to go, instead of only relying on draconian measures.
Now, Minister, we are coming out of COVID, as you know. And yet on the horizon, there's another disease that we're looking out for, monkeypox, right? The World Health Organization has announced it's a global health concern. I know you would have mentioned that it's actually on our list of infectious diseases right now. I mean, as of right now, we don't have any confirmed cases in TNT, but what is the ministry doing to, mitigate at least it coming to our shores? And if it does reach here, what else can be done?
So the WHO met last week, Friday, and they have not yet declared it a public health emergency of international concern. They are looking at more data and so on. However, in Trinidad and Tobago, we are preparing for it. So what we have done, we have listed it as one of the 10 dangerous infectious diseases, alongside things like smallpox, SARS, typhoid fever, and so on. So that gives us the ability to trigger two pieces of legislation, the Quarantine Act and also the Public Health Regulations, where we can isolate, quarantine, and treat persons in a designated facility. Coming out of that cabinet note, triggering those two pieces of legislation, Cora has been designated that facility. So that is treatment. As far as mitigation of cases coming in, we are not going to shut down travel. That is out of the question, because the economic consequences of that are just too severe to even contemplate. So what we have done, we have heightened port surveillance. We have heightened the need for airline and ship captains to report illnesses on board, so that we have a fair idea of persons coming into the country, whether they are febrile, have a fever. We are also doing the fever scanning at ports of entry. All those are mitigation strategies. And now we have the capacity to isolate and treat if we get a confirmed or suspected cases in Trinidad and Tobago.
Minister, are we concerned it's going to hit our shores soon? Because I know one of the CARICOM islands actually had a positive case on an aircraft. So are we concerned at all it might come here soon?
So we didn't take these steps if we were not concerned. So we have been very proactive since about May 20th, when I called the first meeting at the Ministry of Health with CARFA, PAHO, Ministry of Health. So that's from May 20th. So from May 20th to yesterday, and today, those are the steps we have taken. We are also trying to source potential vaccines and potential antivirals to treat persons if we have a suspected or confirmed case. We have also worked with CARFA and TPHL Lab to ramp up their ability to test for the virus. So that is all the steps we have been taken since May 20th to now. So in that 1 month period, we have done a lot of work to prepare for it.
Now, Minister, there was a huge cost attached to preparing and treating the COVID-19 pandemic. Of course, we would have lost a lot of lives, and some of those people would have had pre-existing conditions. Of course, we know in the Caribbean and in the region, TNT has one of the highest rates of non-communicable diseases. I was just wondering, what does it cost the government to treat those with NCDs?
So prior to the pandemic, a survey done by the IDB estimated that the total cost, both direct cost for treatment and indirect cost for loss of productivity, cost this country between 6 to 8 billion TT dollars per year to treat and manage NCDs. Now, let me explain that figure. It's the direct cost for treatment, but also the indirect cost for loss of earnings, loss of productivity when people can't go to work. It doesn't mean the government spends that. It means the country as a whole. It costs the country as a whole that in terms of direct costs and indirect costs, including loss of productivity. We have a very unhealthy population. High rates of diabetes, high rates of hypertension, high rates of cancer, brought upon by lifestyle choices that the individual makes. Our adoption of Western eating habits, American eating habits with fast foods, our over-reliance on street food. Now, I'm not saying don't eat street food. I am not saying don't eat chicken and chips. What we are saying is eat these things in moderation and start to substitute some healthier options. We have launched the TT Moves campaign, which is asking people to become a little more active, walk between 4,000 to 7,000 steps a day. You can download a simple pedometer on your phone that tracks your steps. Do that. Try to aim for 4,000 to 7,000 steps a day. Start to drink about 6 to 8 glasses of water a day. Substitute some sugary beverages for water. And substitute some fast foods and street foods with fresh fruits and vegetables. Enjoy life, but do everything in moderation. Kimberly, it may shock you to know that this country spends about $37 million TT a year on CDAP alone. We spend $99 million a year on free medication for cancer alone. We spend $47 million a year to dialyze patients. Our total pharmaceutical bill provided free to this country is around $500 to $600 million in free medication per year. On top of that, you have to add non-pharmaceuticals, another $200 to $300 million per year. So we spend roughly, in total, pharmaceuticals, non-pharmaceuticals, everything else, about $1 billion a year. The majority of it is to treat NCDs. But we are going to lead the charge. But again, the personal responsibility comes in here. You see, this simple bottle of water is a lifesaver. If we just convert some of the sugary drinks we feed our children, because we are dooming our children to a life of hypertension, obesity, and diabetes. And our parents have to get their children to delink from electronic devices for at least 30 to 45 minutes a day. Send them outside to play, to walk, to run, to skip a rope. I'm not saying to join a gym and pay money. And the elderly, walk around your house, jumping jacks. Simple thing, just get moving. Download a pedometer app on your phone and walk 4,000 to 7,000 steps per day. Lifesaver, costs you no money. And start to substitute some of the fatty foods, oily foods, greasy foods, fast foods for some healthier options. A banana, a mango, pumpkin, bodhi, bhaji. Just do things in moderation. Don't overdo the fast foods. Fast foods and greasy foods is not a healthy meal plan. It's a road to disaster. Drink more of this. Drink more of this and get moving. So we have distilled a complex problem into 3 simple solutions. Get moving, eat more fruits and vegetables, and drink more water.
Now, Minister, it seems simple enough, what you're saying. And so I was just wondering, what has the response been like thus far? And is the ministry working on any other sort of projects?
Yeah, so the response has been very, very good. Members of the public tell me when they see me on the streets that they are really listening to the messages. But we are also working with non-governmental organizations to drive the messaging through. We are working with our clinics and our hospitals because those are the most vulnerable. Those hypertensive patients, those diabetic patients. We are working with the Trinidad and Tobago Medical Association, the Diabetes Association. We are working with all those people to drive the messaging through. And you will start to see ads coming out in the papers.
Now, there's always a need for persons to donate blood. I know the ministry has been encouraging people, to be that volunteer and to come out and donate blood. How has that been going thus far?
Yeah, so let's get to that. That's one of my pet projects. The same way bringing down the rates of maternal and infant mortality was a pet project, and we have succeeded brilliantly. This is another pet project of mine. The current system, Kimberly, of blood donation is a non-voluntary, very coercive and dangerous system. It means if you are lying on a hospital bed and you need blood, you have to rush out and find friends and families and co-workers to donate blood for you. That is stressful. It delays your operation, it delays your recovery. And people sometimes pay drug addicts to give blood. And that is where the danger in that is. So that old chit system, we are trying to decrease that. What we have done is set a national standard now. We want to recruit about 20,000 persons over the next 2 to 3 years to come on to to our register to be true, non-remunerable, that means they get nothing in return. Altruistic, that means I am not doing it for myself, I'm doing it for the country. A voluntary blood donation system. So that you, Kimberly, if you need blood, you are assured that my fellow man has already donated blood that I could use. We kicked it off on June the 14th. The response has been overwhelming. Blood donations, I have the anecdotal evidence so far, has gone up. I'm waiting for the final figures. But people are seeing me again. People are calling in. People are making their online appointments. We have made the system so easy now that people appreciate it. We have re-engineered the way we donate blood, from customer service to our online system. We have remodeled all our blood donation sites so they are more customer focused. They are friendly. They are welcoming. They are not dingy as they used to be. So everything. The online system allows you to self-screen. So you no longer go to a blood donation center. They ask you a series of questions only to be told, well, I had a dental appointment, a dental procedure, so I can't give blood. That turns you off from being a blood donor. So when you go online, you can self-screen to see if you qualify to be a blood donor. That has gone down very well. So if you had a dental procedure within 3 days, you know that upfront. You no longer waste your time being told that, expecting to give blood, and you know you can't give blood again. So we have simplified the process. And the experience, I was at the blood bank, Port of Spain Blood Bank, last week, and I met people there who are very pleased with the customer service. The look and feel of the place is a very corporate look and feel, and they are they have been very welcoming about the online system. So we want to urge people to register with us to become a voluntary, altruistic blood donor. Give blood not because you are being coerced. Give blood not because you have a relative who is dying who needs blood. Give blood because you want to save your fellow man. 1 pint of blood from one person can save 3 lives.
Now, Minister, I applaud what the ministry is doing in terms of the online platform, but I have to go back to the dangerous part of it. I mean, people are paying drug addicts to give blood.
Yeah.
I mean, how is that working out? I mean, is it that they are going around the process of the online screening, or how did the ministry pick up on that?
That was before we did this. So if you, Kimberly, before this, needed blood, you had to find people to donate blood. And very often, the relative who is trying to find blood for you will have to pay somebody to give you that blood. We want to do away with that. So over 2 to 3 years, we are moving away from this chit system to this voluntary system where we want about 20,000 people on our register. It's going to take us about 2 to 3 years to move to that. So we have not done away with the chit system. We are going to run both systems in parallel, but focus on the voluntary side and start to de-emphasize the chit system.
Nice. I have to ask, Minister, your biggest challenge at the ministry thus far?
I have a group of professionals around me that are so wonderfully trained. I think the Honourable Prime Minister made the point during COVID that our local expertise is second to none. Trained in our secondary schools, trained in our primary schools, went to UWI, did postgraduate work here, both here and abroad. Locals are leading the charge. So I can safely say I have literally no challenges at the ministry. I have brought together a team of professionals over the past 7 years. We know what we have to do to keep this country safe. But we need the public buy-in now on issues like blood donation. We need public buy-in on issues like NCDs, right? We are going to lead the way with policy recommendations. We are going to lead the way with the interventions I described about diet and so on. And we are going to give you all the information you need, but we really need the public to buy in to the programs that we are launching.
So, Minister, let me take it a different direction. If no challenges, what are some of the key takeaways as the Minister of Health thus far?
Okay, so I have been in this position for 7 years
Yes.
now. I think I'm probably the longest serving Minister of Health in the history of this country. No job comes without challenges. No job comes without some issues. But as a manager, I have learned over the years, and even I will think my private life and time in opposition has prepared me well for the challenges running a Ministry of Health. I think the health ministry in any country is one that everybody shies away from. But I have come to love the system. I recognize, and I will say this, in 2011, when we were debating the Children's Life Fund bill, I was an opposition senator in the old Red House before we went across to the waterfront. That's to tell you how long ago this is. The then Minister of Health, Terrence Cornelis, was debating and piloting the Children's Life Fund bill. You remember those days? I, as an opposition senator, got up and said, Minister, you will get no thanks for the thousands of miracles that your health care providers perform on a daily basis. But let one thing go wrong and the media will crucify you. Unfortunately, in Trinidad and Tobago and elsewhere, because I talk to ministers of health from the CARICOM region, it is common to paint and to characterize health systems around the world based on one issue that goes wrong, and we forget the 999 that goes well. Things will always happen in a health system, and I am grateful for every nurse, every doctor, lab tech, patient care escort, cleaner, janitor, security guard, who turn up every single day to do their best. And let me tell you something. You see, we don't appreciate what we have in Trinidad and Tobago. We don't. But people from outside looking in, foreigners who have family here, who hear what they get in Trinidad for free, will tell you that Trinidad and Tobago, we should be proud of our healthcare system. $1 billion free in medication, non-pharmaceuticals. $27 million free medication for HIV. $99 million free for cancer. Abroad, if you don't have insurance, Kimberly, you die. So let's be careful how we characterize our healthcare system. Let's work on the problems. I'm not shying away from that, but I am saying we perform miracles every single day that really goes unnoticed.
Now, Minister, I'm sure you've heard the argument, of course, in the public domain that, yes, we have free healthcare, yes, we have, free prescription, but sometimes it's hard to get prescription sometimes for some of the diseases that people are dealing with. I mean, how do you respond to that one?
So I don't know when last you heard those complaints. That used to be a complaint. We have worked very hard to ensure that we have a safe, reliable supply of pharmaceuticals into Trinidad and Tobago. The issue of drug shortages is a global one, but we pretend it's only in Trinidad and Tobago. And why? Because we have global supply chain problems for 2 years now because of COVID. And the war in Ukraine is going to exacerbate that. We are a small player in a global drug supply chain. However, I think between the Ministry of Health and NIBDEC, we have done remarkably well to keep our supply chains open for the people of Trinidad and Tobago.
Looking back in the past over 2 years as you've managed the COVID-19 pandemic, is there anything as you reflect on it that you think you would have done differently?
That's a question I get very often, Kimberly. I know hindsight is normally 20/20, but objectively, if I look back on it, you have to remember when COVID hit in late 2019, no one knew about COVID. When we were escalating the response in early 2020, no one knew about COVID. Everybody thought that after 3 months, we go back to normal. We shut down schools for a month. Everybody thought we'd go back to normal. So you were building a plane and flying it at the same time. When we look back on it, I think every decision we made at that time, with the information we had at that time, was the correct decision. You are building a plane and flying it at the same time. The world never knew about COVID. The world never knew about long COVID. The world never knew. Now people know what a comorbidity is. COVID has heightened and brought certain things to the fore. But I am comfortable and confident that every decision we made at that time over the past 2.5 years, with the information we had at that time, was a sound decision, was a correct decision.
And finally, Minister, closing thoughts.
Closing thoughts. I really want to thank every single healthcare worker again. We can't thank them enough. I want to thank the team at the Ministry of Health, the CEOs of the RHA, and every one of the roughly 17,000 healthcare workers we have in the system. I will go back to what I said when we were debating the Children's Life Fund Bill, when I told then Minister Terrence Cornelis, said, Minister, you will get no thanks for the thousands of miracles your people do every day. It's a thankless job, we know that, but we are here to give public service. And I want to commend every single healthcare worker who rose to the challenges of COVID over the past 2.5 years and really showed this country what local grown talent can do. I think that is the biggest takeaway, and my heart brims with pride and thanks for that.
Well, Minister, let me say thank you so much for the work that your ministry has done. And of course, thank you so much for joining us on this week's episode of Delving Deeper.
It has been my pleasure and my honor to be here, Kimberly. Thank you very much.
And join us again at the same time next week for another episode of Delving Deeper. I am Kimberly D'Souza, and on behalf of our entire cast and crew, have a good night.